staying safe and healthy out there. Today, on this Monday afternoon, I want to take a moment to just have a conversation with you all regarding what's happening. So as folks are joining in, welcome, and I do appreciate the time that you're taking to join me this afternoon. You know, there's lots happening, and I'm joining you from Queen's Park, from our Queen's Park office. There's going to be a vote in a short little while on Bill 218, which is a very, very important bill. And you know, we're hearing a lot about what this bill encompasses, and I've talked a little bit earlier on about how it really prevents families from seeking justice for their loved ones who suffered in long-term care. It's really an illegal attack on families. It erases legal rights of family members. And this bill is also the one that's about ranked ballots, you know, undermining local democracy and the power of local democracy to, you know, do their elections the way they want. So this Bill 218 is being debated right now. So as I wait to go and vote in just a few minutes, I want to talk to you all about what's and I'm just going to and hi Moti Mohitur Chaudhary, Imtiaz Ahmed, who joined in. Thank you, folks. So I want to take a moment to talk about what's happening in Scarborough Southwest. And for that, first, a big shout out to the SBCA, the Scarborough Bluffs Community Association, to Hector Catre, who has been doing some great work pulling all the numbers together. So let me just give you the numbers for Scarborough Southwest. Now, the Cliffside has the Cliffside neighborhood has gone from 108 cases to 116 in the last week, which is 74th hardest hit neighborhood of the 140 neighborhoods. Now these are the COVID numbers that's available in the city's, you know, updates that they do in terms of COVID cases across the city. In terms of the Cliffcrest neighborhood, we have Cliffcrest has gone from 110 cases to 117 cases in the last week, which is sustaining a ranking of 73rd hardest hit neighborhood of 140 neighborhoods. We also have Oak Ridge, which is my neighborhood, which has gone from 167 cases to 176 cases, and that's 51 on the list of the 140. Hi everyone, hi Tanvir, hi Ahmed. Thank you so much for joining me, and thank you for the support. Now let me just continue with Clare Lee and Birchmount, which has 217 cases. Cases to now 244. That's 244, folks. That's 31st hardest hit neighborhood out of the 140 neighborhoods. And then the Scarborough Village area has gone from 213 cases to 261. That's 32nd on the list of 32nd, actually it was, now it's 26th on the list of 140 neighborhoods. And then the Eglinton East area has gone from 213 cases to now 251 cases. And that's jumping the ranking from 32nd to 28th. These numbers are scary. These are very, very, very high numbers, and these are just some of our neighborhoods across Scarborough Southwest. And I just wanted to take a moment to share these numbers with you, because that's what we're facing right now. And as you see the news, as you see, you know, medical experts across social media, you know, ringing alarm bells, we really have to be careful. I see Rahan Mama joined in. Hi, Rahan Mama. It's so good to see you all joining in. I hope you're all staying safe during this difficult time. I hope your family members are safe during this difficult time, because the cases are going up. And we have, across the province, we are reporting 1,487 new cases, with 508 new cases today. We also had 10 new deaths. And I want to also take a moment to share with you that in Scarborough, so just a little bit north of Scarborough Southwest, there is a long-term care home called Kennedy Lodge, which is managed by the same company, Sienna, which manages Midland Gardens, one that we have been dealing with in Scarborough Southwest. So Kennedy Lodge recently had 29 long-term care deaths. This this just continues, and this afternoon we saw the minister tweet how wonderful she's done. She's done in long-term care. She's talked about how great they are, how prepared they are, and oh, actually no, Kennedy Lodge is managed by Rivera. So another private company that has been questioned for the type of care they have had and the questionable measures they have taken during COVID. And like I said before, this bill that we are debating right now, 218, is one of those bills that really makes it harder for family members, for individuals to fight for their loved ones, to stand up for their loved ones. For those who suffered for the deaths we've had in long-term care homes. Once this bill passes, all of these legal cases will be undermined, and it really is a huge problem that we're facing right now with the level of with the way this government wants to protect their friends, people like Mike Harris, right? People like Mike Harris who destroyed this province, who destroyed our long-term care system, the aging population, the way they have been taken care of. People like Mike Harris who now sit on the board of Chartwell, so that they can be protected. This government is now going ahead and passing a bill that will protect these people from any consequences. So the Kennedy Lodge is just one example of what's going on. We saw some of the cases in other homes in Scarborough Southwest as well, including Midland Gardens. So we had let me just go back to some of the folks who have joined in. Assalamu alaikum, Humayun. Hi everyone. So let me just, yeah, thank you so much, folks, for joining in. Let me see if there is, let me just take a moment to tell you what we have seen in our schools as well. So we've seen over 100 school-related COVID cases. So yesterday we actually had 198 cases in our schools. And what's been really disappointing is that we have the Minister of Education tell us that he is still figuring out what to do. He's done very little to actually protect students, protect our kids, protect educators at a time like this. And we are now actually hearing from medical experts who are expecting around 6,000 cases per day in early December. Folks, we need to do better. We really need to do better. There's, this is real. This government is sitting on $9.3 billion that that is supposed to be for COVID response, and it's just really heartbreaking to see how this government is, trying to really put some of these big issues under the rug and really save money, save the COVID response money that's been provided by the federal government. They're trying to, use a pandemic to pass bills where they're providing more protection to their friends, undermining democracy, undermining environmental rights, but at the same time doing very little for people who are struggling, people who are dying, people who really need support. Our schools, our long-term care, our hospitals. It's devastating. We have our neighborhoods that's seeing 200 cases. So 200 cases per 1,000 people, and this is according to the Toronto neighborhoods COVID-19 data. So I want to take a moment to say how proud I am of the local people who are doing everything possible to protect themselves, to protect their neighbors, to protect their family members. But there's a time when you can do so much, but if our governments at each level are not providing the guidelines, the clear guidelines that you need, are not doing enough to support you so that you can actually stay home, you can actually protect your family members, you can actually survive, you can pay your rent, you can do the things that you need to do, it becomes really, really hard for people to get through those days. And right now we're at that tipping point where if governments don't step up, if governments don't do the right things, then in a few weeks we'll be at an even worse stage than we are right now. And a few months back, when our highest numbers were just 500-600, and we were going through the different stages, we were, in the opposition, we were talking about how much the government needs to do to protect each other, to protect families, so that we don't hit a point like we have right now. And here we are, because of the way the government has mismanaged this whole COVID-19 pandemic. And now we have, doctors, medical experts, public health officials just begging the government to do more. They're asking the government to step forward and actually provide the support that we need. And the amount of confusion the government has created has made it even worse. It's made it harder for people to figure out what they're supposed to do. We have, I see that Chitta Bhumik joined. Dada, thank you so much for joining in. I know some of the work that we're doing, some of the folks who are joining in from Scarborough Southwest and across Scarborough, Ward Smith joined in. And actually, let me just take a moment to see what Ward wrote. Can you provide a list of long-term care homes that don't have a good health and safety record? That's a long list, my friend, but we can definitely provide you with a list of the homes in Scarborough Southwest as well as in Scarborough, and what's happening and what their status is. The current data on the provincial website is a little outdated, so they're always a little bit delayed, but we have been monitoring the homes in Scarborough Southwest, so I can tell you, what that looks like, and I can also make sure that we get some numbers for homes in Scarborough as well, so you know what's going on. We have Chittoda joined in, and he said, thank you so much. I truly appreciate the support from everyone and the love and the work that you're doing to protect each other. I know it's been really tough for folks, especially for those of you who are frontline workers. So some of you are frontline workers that I've talked to, and you have had to go to work. So thank you for what you're doing. And I know that that's a fight that's ongoing in terms of making sure that workers are protected as well, making sure that those who have to go out there and do their job to make sure that the rest of us can stay home. It's so essential that their workplace is safe. There is guidelines provided to them, and managements, so that that work environment is safe for them. Nazma Begum joined in as well. I want to go back to some of the things that I was talking about for the COVID cases, actually, because Yesterday we saw what happened with some of the conversations across social media about the cases in Brampton, and trust me when I say this, I'm not definitely justifying anyone who's not following guidelines. I think we all have a huge role to play, but it's also important to understand how some communities are affected. Much more disproportionately impacted than others. Um, Scarborough Southwest is one of those communities, and like the numbers that I was just going through, across Scarborough Southwest, we have communities that are marginalized, that are racialized communities where people have to go out and work, people who are essential workers, people who are healthcare workers. And these folks have to go out and work, and they're at a much higher risk than others. And experts say that our hospital capacity is currently at risk of being overwhelmed of what's going on. And then we also know that locally, the support that these folks have, it's not enough. So we heard that in Scarborough, our local hospitals did see cases, and it really goes to show how years and years of neglect in our healthcare system by the previous governments. So yes, the Ford government needs to do better, but the previous governments have really squeezed, all sort of uh, really squeezed out the healthcare system and put them in a really fragile condition. And this is the result of it right now. We also have communities like ours that don't have the ability or the social support system that they need to be able to protect themselves. And that has a huge impact in how they're affected by COVID than, say, other areas. And I think it's really important for us to recognize that. I think, it's so easy for us to say, stay home, we're all in this together. But we're all not in this together in the same way. People are affected differently. People have, the social determinants of health that we have in Scarborough is very different from some communities than others. And not everyone is able to stay home. Not everyone is able to, have the same level of protection as others. And that's the result of years of neglect, years of cuts to many social services, and the fact that we also need to do better when it comes to affordable housing, when it comes to providing better access to healthcare, making sure that people have good working conditions, people have a safe working condition. I just found out that the Tim Hortons near my office has had cases, and it's really disappointing that the employees the management was trying to hide the information of employees who got COVID. And when this got out, the employees are being blamed, and that's just unjust. This is the type of threats. This is the type of issues that actually makes it harder for employees to come out and protect themselves. This is the type of things that makes it harder for people to be able to, protect their jobs, to protect their family members, and save their jobs. Right? And ultimately, what does it do? It puts people at risk. We have. Fazlur Rahman Litton joined and said, what is the latest information about the hospital? All are overcrowded with COVID patients. Yeah. And while not only are they overcrowded with COVID patients, you're absolutely right, but we also have a lot of surgeries that's been postponed. I believe it's over 200,000 surgeries that's been postponed, and this means that while we're trying to protect ourselves from COVID-19, there are people who are not getting the medical care they need. There are people who need surgeries urgently. Recently, I was talking to someone who needs whose daughter had to wait for quite a while to get her surgery, and just this week they're hoping that she will be able to go for her surgery. And it's just there's so many elders, so many people who are immune compromised, or so many people who are at risk that need to be able to get their treatment. So it's not just that they're at risk of this virus, but also of not getting the treatment they need. They're at risk of that as well. Um, we have experts say that our hospital capacity is currently at risk. And just exactly what Fazlur Rahman was saying. We could be seeing 150 plus COVID-19 related hospitalization in the coming days, and this was just reported. As we expect to have over 6,000 cases per day, 6,500 actually cases per day. So this will mean that we're postponing these surgeries even longer, and this will mean that more people, obviously the rate of infection will increase, and then obviously the level of care that people can get for their day-to-day, health needs will be completely, put on the end of the line. The do we have so? Malik Road, do we have any suggestions for residents of Scarborough Southwest? Is there any way we can stay beside you and help you during this pandemic? Thank you so much. Yes, there is so much you can do, but first and foremost, make sure to protect yourself, make sure to protect your family members, make sure to follow all the guidelines. So whether, if you're attending any religious institutions, whether you have to go to work, make sure that you are following all the guidelines and protecting yourselves. You can stay informed using our social media, but also we have regular newsletters that we send out. So if you share your email address, we'll add you to our newsletter so you can find out exactly what's going on, any COVID-related guidelines changes, and we will do our best in making sure that we provide clear guidelines to you as well. Ahmed Road, we want to see what people are looking for related to COVID-19. Thank you so much. We have there is a lot of information out there, so it's really hard to keep up. But as long as you continue to follow the city's public health guidelines, that's the best way you can stay informed and make sure that you do you do your best to protect your family and your neighborhoods. And it's the numbers are increasing, so we have to be very very vigilant. We have to keep up what we've been doing. In fact, we have to do even more. So yes, sometimes the numbers increase. I mean, well, it's been a long time, but it's really hard for us. If you I mean, it's hard for everyone right now. Everyone's tired. It's a really awful situation, and it's harder for little ones. It's harder for some of our elders, some of our parents. It's harder for folks who have disability, people who cannot go outside for a walk, people who are lonely, people who are facing domestic abuse. This is a time where there are a lot of people whose life's at risk by staying home, and who are now in this sort of this captured within the four walls because of COVID-19, but also the way they are in their whatever their situation at home may be. It's really hard, and it's been now months and months, and just the fact that we're almost at the end of the year, it is exhausting, and we really want this to be over. But that means we have to be even more vigilant, and we have to be extra careful of how much what we're doing, how many people we're seeing, we have to make sure that we really limit all the activities that we do, because this is the test right now. We cannot give up. We just cannot, for the sake of our loved ones, for the sake of our communities, we cannot give up. And yeah, the some of the numbers that we're seeing, and then so someone just wrote, many are coming to work even while symptomatic because they can't afford to be in quarantine. Yeah, and that's we have seen that with a lot of folks who are at risk of losing their jobs. So I completely agree with you. I think there is a lot of work that needs to be done to make sure that people have better protection of their employment, right? And this is why we're pushing for paid sick leave, especially during this time. Something that this government really needs to take seriously, really needs to step forward and accept. And you can actually get it. You can actually have a say in pushing this government to make this decision. All of you who are watching, you have so much power in making governments accountable. You have so much power in making sure that your voices are heard. So, no matter wherever you are, reach out to your local MPP. If you're in Scarborough Southwest, write to the premier, write to the ministry, write to us, and we'll make sure that we share that with the ministry. It's so important that we push this government to make some of the mandatory changes that protects people. We cannot have people going out there when they are symptomatic or asymptomatic and maybe at risk of carrying COVID, and then exposing to others. It is so important that we limit the spread of this virus, especially as we're so close to actually having a vaccine, but we don't yet. So we have to make sure that we do everything to stop the spread. It is. We also have someone wrote, what's really awful is the numbers that they are publishing are not the correct numbers. Yeah, this government is the amount of lies that Premier Ford has said in the House, the amount of lies we're hearing from ministers and this government, throughout the pandemic, it's mind-boggling. It is just, it's unbelievable. I mean, the fact that they were not listening to public health experts, and the fact that they are not willing to share what kind of advice they're getting from public health experts or the chief medical officers, and they're not willing to be open to public about about what kind of advice they're getting and how they're making the decision, really goes to show that they have a lot to hide. Just a few days ago, my colleague proposed a bill in the House, France Gelina from Nickel Belt, who's our critic for healthcare. She proposed a bill in the House, a motion to ask government to be transparent. So just tell us what kind of evidence, what kind of medical advice you're getting from the chief medical officers. When you say expert panel who sit at the table and this is how the decisions are made, well, tell us what decisions were made and tell us what advice were given. And this motion will actually make the government more accountable, be more open. And here we are, finding out just within, just a few days ago that some of the measures that were taken were not taken using the advice of chief medical officer. And that is so problematic. And if you look at the way the provinces have managed COVID-19, some of the provinces that have done well are the ones that are following, medical health advice, that are following experts' advice. But Ontario is one where now we're expected to even go down a path that's much more dangerous, because we have a government that's not using science, that's not using fact-based decision making, and we have to do much better than that. We have to be even more vigilant. We have to be very careful, but we need to make sure that we keep our government accountable, because right now they're not being accountable to the people. The cases that we are seeing in Scarborough Southwest, we will continue to fight for more testing centers in the riding. We will continue to fight for better services, better support for communities across Scarborough Southwest, and we will continue to fight for clear information, clear guidelines, so that all of our community members can know what's going on and have the right information. And you can always reach out to our office. I will continue to do this kind of conversation so that I can hear from you and share with you what's going on, share with you some information about our local community, COVID numbers, but feel free to reach out anytime. If you need support, if you're facing a situation in your workplace, or if you're trying to get your flu shot, whatever it may be, you can always reach out to us, and we'll make sure that we provide you with our contact information on this post as well on our social media. So I want to thank everyone who's joined in on our different platforms. Thank you, everyone who's for your questions. And for today, I will end here, but say thank you so much for joining me today. Thank you for everything that you're doing to keep yourself and your family members and your community safe.